طيب السلام عليكم ورحمة الله تعالى وبركاته. مرحبا بكم في المحاضرة الثانية ل cardiovascular physiology. Last time we have spoken about cardiovascular anatomy, which is paramount importance for understanding of physiology. And this lecture we are going to speak about electrocardiogram or ECG and echocardiogram or echo for short. I will just carry on with the lecture. If you have any problem with the sound or picture at any time, just let me know. One second. The components of this lecture include conductive system of the heart, which we have covered last time in our previous lecture, but we will just go across the different components of the conductive system very quickly. Then we will compare between the ECG and echo. Then we will talk about types of recording and the leads and the differences between electrodes and leads, importance and indications of ECG, normal ECG, waves and intervals, abnormal ECG, and then we'll speak about cardiac arrest and advanced life support. ALS stands for advanced life support. Then we will talk about how we can interpret ECG. After that, we'll move to the echo. We will give you an idea. Echocardiogram is not part of your curriculum, but it's very important to know the echo general principles and the views and the modes. As I said, anatomy is important to the understanding of physiology. Therefore, I'm going to revise with you. Those who wants to participate, please unmute yourself now. And I need somebody to just go through the conductive system of the heart very quickly. This is just revision of the anatomy because this is very important for understanding ECG. Somebody quickly because the lecture is long. What are the different parts of the conductive system of the heart? Gen 1, Shahad, Dara, can you hear me? Anybody?
Yes, we can hear you, doctor.
Yeah, I want a volunteer to give us an idea about the different parts. We have already covered this. In the last lecture, we said the conductive system of the heart is composed of the sinoatrial node and the atrioventricular node. There are branches between the sinoatrial node and atrioventricular node. These are called internodal pathways, or the other name of them is Pacman's bundle. And then there is the AB bundle. The other name is His bundle. There is only one S in His bundle. His bundle or AB bundle. And we said that the AB bundle divides into AB branches, right and left AB branches. And then the left AB branch is, I'm sorry for that, I'm still on clear. The left AV branch divides into anterior and posterior fascicles. They are called fascicles, these two parts. And the small branches at the end of the fascicles on the right bundle branch are called Purkinje fibers. Is that clear?
Yes.
Do you understand the conductive system of the heart?
Yes, doctor.
So we move to definition of ECG. ECG, or electrocardiogram, is an electrical activity tracing or recording of the heart from the surface of the body using electrodes. So there are different names we'll go across today. I want you to be very familiar with. So the electrodes are the devices put on the surface of the chest in order to record the electrical activity of the heart. And the electrical activity of the heart represents the sum of the action potentials of the myocardial fibers of the muscle of the heart, being atria, ventricles, and there are different phases of action potential, as you know, including repolarization and depolarization. There are different waves and intervals we are going to discuss today, including the P wave, the QRS complex, and the T wave, and the U wave, which doesn't show in the normal ECG. There are different similarities as well as differences between echocardiogram and ECG. The similarities include both tests are very widely used, so you have to understand as a doctor in and out the ECG and echocardiogram, because they are very widely used. They are non-invasive tests and they take very short time to do, 5 minutes for ECG and 20 minutes for echocardiogram on average, and they are non-costly, therefore they are very widely used. And the other similarity is also that there are no known risks for both of them, so there is no any side effect of doing an ECG or echocardiogram to any patient. Now we move to the differences. The main difference is that the ECG is tracing, recording of the tracing of the electric activity of the heart, while echo is ultrasound imaging of the mechanical events of the heart. So if you see this is the ECG, you see it as a paper, but in the machine it will be like electrical tracing, recording. However, the echo, you will see the heart as a contracting, mechanically active organ with color, and the color is called Doppler. We're going to cover that when we talk about echo. I will just carry on. If you have any question or comment at any time, just feel free to unmute yourself and comment. We start with the leads. So we said we have electrodes. What you put on the body, these things are the electrodes, and what you measure on the ECG are called leads. So generally speaking, we have 12 leads in a complete ECG. We call it 12 lead ECG, and these 12 leads are divided into unipolar leads and bipolar leads. In order to measure any electric current, not only in the body, anywhere, there must be 2 points. So you want to measure the electricity between 2 points. These 2 points are the electrodes. So when you have an active electrode with an inactive electrode, this is called unipolar, because it has got only one active electrode. However, when you have 2 active electrodes and you are measuring against an inactive electrode, this is called bipolar. So it's called bipolar because it has got 2 active electrodes. So the inactive electrode in both uni and bipolar leads is called the reference electrode. The inactive electrode is called the reference electrode, and the reference electrode is put in what we call LL, or the left leg. LL. This red one is the inactive electrode. So the inactive electrode is used for all the other unipolar and bipolar leads. The isoelectric line, when we see any ECG, there is a line in the middle, that's called the isoelectric line, and if there is any wave above that line, this is called a positive wave, and vice versa. So any wave below that line is called negative wave. Now we have spoken about the inactive electrodes. Now the active electrodes are divided, as we are going to discuss in the coming slides, into chest electrodes starting from V1 to V6, V1, V2, V3, V4, V5, V6. These are called chest leads. And limb leads. The limb leads are put on the right arm, RA, left arm, LA, and right leg, RL. The left leg is the inactive or reference electrodes. When you don't ask or talk, I will presume that you understand what I'm talking about. So the unipolar leads, as I said, there are limb leads and there are chest leads. These are the unipolar leads. So you have 3 limb leads and 6 chest leads. These are 9 leads. These 9 leads are the unipolar leads. So how many bipolar leads? We said in the ECG there are 12. 3 of them are limb leads and 6 of them are chest leads, and the 3 limb leads and the 6 chest leads together form the unipolar leads, which means out of 12, how many bipolar leads should we have?
3.
3. So we only have 3 left. So out of the 12 lead ECG, we have 9 unipolar leads, and these 9 unipolar leads are 3 limb leads and 6 chest leads. The 3 limb leads are in the right arm, left arm, and right leg. The right arm is called AVR, the left arm is called AVL, and the left foot is called AVF. V is for Victor, A is for augmented, so AV is augmented vector, right arm, left arm, foot. This is the old name. The A is redundant, so in the new books you'll find that they have deleted the A and they are just calling the limb leads VR, VL, and VF. As I said, the reference, which is the inactive lead, is the one which is in the left leg, and this was one of the questions in the quiz. So the inactive reference electrode is in the left leg. Yes?
In the left foot or the right foot?
The inactive is in the left. Sorry, it's in the right. Right. Sorry. There is a the left foot. The left foot is. You are absolutely right. Sorry. This is wrong here. So the inactive is in the right because the left foot is the AVF. Why? Who's asking that question? This is very important. Who said that point?
Me. I just wanted to make sure.
No. What's your name? Sorry.
Go on. Sorry.
Jawan. Why is the inactive in the right foot? Why the inactive reference is in the right foot? Because the heart is tilted towards the left side. So the one which is away from the heart is the inactive. Does that make sense?
Yes, it makes sense. Thank you.
Yeah. The right arm and the left arm are close to the heart. The left leg is in the same side of the heart. The only limb lead which is very far away from the heart is the right leg or the right foot. Does that make sense?
Yes. Doctor, please, can you repeat?
I will say that again. One second, I just look for something. There are 3 limb leads in the 12 lead ECG. Okay, 12 lead ECG is divided into unipolar and bipolar leads. Is that clear? I want yes, so that I make sure you understand. So there are electrodes and leads. The electrodes is what you put in the body, and the leads is what you measure in the ECG. Is that clear? Okay. Now we speak about the electrodes are these. Now we speak about the types of leads we have in the ECG. There are two types, unipolar and bipolar. The unipolar have got two types, limb and chest. So unipolar limb leads 3, unipolar chest leads 6, bipolar 3. We will speak about the bipolar in the next slide. I will show you the bipolar leads just to show you. So these are the bipolar leads. The bipolar leads are called 1, 2, 3. Okay? So we go back to the unipolar leads. Unipolar leads are two types, limb leads and chest leads. There are 4 limbs, but we only have 3 limb leads in the 12 lead ECG. The 3 limb leads are the both arms and the left leg. See, right arm, left arm and the left leg. The right leg, the heart is here, because the right leg is the only limb out of the 4 which is very far away from the heart, so that's the inactive lead, the inactive electrode. This one, the right leg. The other name for it is the reference electrode. So the limb leads are called AVR. When I say RA here, I'm not talking about the lead, I'm talking about the electrode, okay? But the lead is called AVR. Then the AVR lead is between the RA electrode and RL electrode. Does that make sense? Because it's unipolar, between one active electrode and one inactive electrode. While the AVL lead is between the LR electrode as an active electrode and the RL electrode as an inactive electrode. Do you understand the difference between electrode and lead?
معلش, could you
Okay, I'll repeat it again. In ECG, there are electrodes and leads. Is that clear?
Yeah, clear.
The electrodes is what you put into the body, is what you stick to the body. These are called electrodes.
Okay.
So when somebody wants to do an ECG for a patient, he sticks different stickers, 9 stickers, actually 10 stickers in the body like this. These are 6 in the chest and 4 in the limbs. So these 10 stickers are called electrodes. Is that clear?
Yeah.
These electrodes are called as follows. The chest electrodes are called V1 to V6. The limb electrodes are called RA for the one towards the right arm, LR for the left arm, LL for the left leg, and RL for the right leg. They don't put it on the leg. They put it in the tummy, like abdomen, close to the leg.
Oh, okay.
So these 10 stickers are called electrodes. Do you understand the electrodes?
Yeah, clear now.
Okay. In order to produce leads in the 12 lead ECG, you need to create a current or measure a current between two electrodes. So the lead is the measurement of the current between two electrodes. That's what you see on the ECG. Is that clear?
Yes, clear.
The right leg is the furthest or the farthest from the heart. Therefore, the right leg lead is the reference or inactive lead. Is that clear?
Clear.
The right leg contributes to all the 12 leads as one lead, as one electrode. Is that clear?
Clear.
There is always inactive electrode in the 12 leads. Okay?
Yeah, okay.
The active lead, the active electrode in the leads, in the 12 leads, can be either 1 or 2. If it is 1, these are called unipolar leads, and if it's 2, these are called bipolar leads. Is that clear?
Yeah, clear.
So if you have two leads, two electrodes in the lead, this is unipolar lead. If you have 3 electrodes in the lead, 2 active and 1 inactive, this is called bipolar. Is that clear?
Yes.
So now we move to unipolar leads. So what are the unipolar leads? What's the definition of unipolar leads? Unipolar lead is between 2 active leads and 1 inactive leads. So yeah. So if you are measuring the ECG between 2 leads and the inactive, it's called bipolar. But if you are measuring it between 1 lead and the inactive, this is called unipolar. So V1 RL is
Unipolar.
unipolar. Which lead? V1.
Yeah, V1.
When I say V1 here, I mean the lead between V1 electrode and R1 and RL electrode. So V1 can be a name of an electrode as well as a name of a lead between the V1 electrode and RL. Does that make sense?
Yeah.
So when you measure the electricity between V1 and RL, this is called V1 lead. V2 and RL, this is called V2 lead. V3 and RL, this is called V3 lead. V6 and RL, this is called V6 lead. And from V1 to V6, these are called test leads. When you measure between the limb leads and the inactive electrode, these are called the limb electrodes and the inactive electrode, these are called the limb leads. So when you measure between RL and RA and RL, this is called AVR lead. So the names of the chest leads are similar to the electrodes, but the names of the chest of the arm leads are different from the electrodes. When you measure between RA and RL, this is called VR. When you measure between LR and RL, this is called VL. When you measure between LL and RL, this is called VF. Does that make sense?
Yeah.
So because you haven't studied, we are spending a lot of time explaining that. But I will just say it one last time. In the 12-lead ECG, there are unipolar and bipolar leads. There are 9 unipolar leads and 3 bipolar leads. The 9 unipolar leads are divided into 3 limb leads and 6 chest leads. The 3 limb leads are between the right arm and the right leg, the inactive electrode, and this is called VR, between the left arm and the inactive electrode, and this is called VL, between the left leg electrode and the right leg electrode, and this is called VF. The chest leads are easy because the names of the electrodes are similar to the names of the leads. When you measure between V1 and RL, this is V1 lead. When you measure between V2 and RL, this is V2 lead. When you measure between V6 and RL, this is called V6 lead. Now the last thing I want to explain here is the sites where you put these leads. So you put the limb leads opposite to the limbs in the corners, and the chest leads you start in the second intercostal space. How do you know the intercostal space? Anatomy. How do you know the second intercostal space?
At the sternal angle.
Thank you very much. Well done. So sternal angle of Louis, you can feel it on yourself. You put V1 on the right and V2 on the left. V3 is between V2 and V4. Where is V4? Fifth intercostal space mid-clavicular line. So where is that anatomical site? What is it? What is it opposite to? Why is it important? V4.
Apex of the heart.
This is the apex of the heart. Thank you very much. Well done. So you put this in the fifth intercostal space mid-clavicular line, which is corresponding to the apex of the heart. Normally you put V2 and then you put V4. V3 will be in the middle between them. V5 and V6, these are the anterior axillary line, and this is another mistake. Sorry, I did this presentation very quickly today because I was on call. This is the mid axillary line. So let me just correct it. Where is V5 and 6? Where is V5 and 6?
V5 is at the fifth intercostal at the anterior axillary, and V6 at the mid axillary.
Yeah, V5, well done. V5, they are both V4, 5 and 6, they are all on the same intercostal space, which is the fifth intercostal space. The difference between them is they are all in the same intercostal space, V4, V5, V6. The difference between them is a vertical level. So this is mid-axillary, sorry, mid-clavicular line. This is anterior axillary line. This is mid-axillary line. واضح؟ I'm not going to spend more time on this, but that shows you why is it important to do the revision before the lecture, because that saves a lot of time. So we move to bipolar leads. So there are 3 bipolar leads because we have already had 9 unipolar leads. The 3 bipolar leads, they are all measured between the limb electrodes. They are all related. They have nothing to do with the chest leads. They are all measured from the limb electrodes. Okay, lead 1, we said bipolar leads, we have 2 active and 1 inactive. So when you measure between the arms, which is right arm and left arm, and the inactive electrode, this is called lead 1 bipolar. When you measure between the right arm and the left leg and as active electrodes and the inactive electrode in the right leg, this is called the second bipolar lead. When you measure between the left arm and the left leg as two active electrodes and the inactive electrode, this is called the third bipolar lead. Is that clear?
Clear.
So we have 10 electrodes. Do you know where we put the 10 electrodes for the ECG? 4 arms and 6 chest electrodes. These 10 electrodes will produce 12 leads. These 12 leads are divided into unipolar and bipolar. The unipolar leads are divided into limb 3 and chest 6, and the bipolar leads are divided into 3 leads called 1, 2, 3. Now we move to Eindhoven triangle. Eindhoven triangle is a triangle formed by the 3 bipolar leads. Lead 1, lead 2, lead 3. The normal heart will be in the middle, right in the center of this triangle. And the 3 angles of this triangle are equal. So it's equilateral triangle. And the heads of the triangle are the points where you attach the 3 active limb leads. So you put the RL electrode here, LA electrode here, and left leg electrode here. This triangle is important because we use it to measure something called the cardiac axis. And the cardiac axis by definition is the orientation of the heart. When you are standing, your heart apex is going or facing downwards and to the left. So the heart apex is, if this is a human being, his heart apex is going downwards and leftwards. Therefore the normal axis, if this is a 360-degree circle starting from 0 here, the normal axis is between -30 and 90. So if the apex is facing anywhere here in this color, then the heart is not enlarged and there is no disease, and this is called normal axis between -30 and 90. It can go up to 110, up to here is accepted in tall people. Why? The tall people can have more positive normal cardiac axis. Why? عشان هم طوال الهارت بيكون hanging مدلدل، يعني الهارت بيكون نازل لتحت، نازل لتحت، ماشي على السنتر because they are tall. Therefore you can accept a little bit more than 90 في tall people. But the normal axis of the heart, the orientation of the heart relative to the horizontal plane, is between -30 and 90. A lot of people find this difficult to understand, but if you understand that cardiac axis is the orientation of the heart in relative to the horizontal plane, and because the heart is normally facing downwards and to the left, the normal axis is between -30 and 90. LAD stands for left axis deviation. Don't mix it with left anterior descending artery. This is left axis deviation. If the patient has got LVH, which is left ventricular hypertrophy, if the left ventricle is big, then the left ventricle will push the heart to the left, and the axis will be less than minus 30. This is called left axis deviation. And vice versa. If the right ventricle is enlarged or there is right ventricular hypertrophy, the heart will deviate to the right more than 110. As we said, the normal is up to 90, but up to 110 is accepted, especially in tall people. Therefore, anything more than 110 is called right axis deviation, or RAD. The area in between, which is less than minus 90, the yellow, is called extreme axis deviation. So the heart should not go in the opposite direction. The heart facing here. If the heart goes all the way beyond the left atria, left axis deviation and right axis deviation, this is called extreme axis deviation between minus 90 and minus 90 and plus 180. The red area here. Sorry, the yellow area. So minus 30 to 90 or up to 110 is normal axis deviation. Between minus 30 and minus 90 is left axis deviation. Between 90 and 180 is right axis deviation. Between 180 and minus 90, the yellow area is called extreme axis deviation. I want a volunteer to tell me about the axis deviation. What is axis deviation? What's normal axis deviation? What's abnormal axis deviation, including left axis deviation, right axis deviation, and extreme axis deviation? I know this is tough, but yes, go on. Who's that? Go on. شهد تفضلي.
الاكسس ديفيشن هو لما الزول يكون واقف الابكس حق الهارت حقه بيكون facing which direction.
ايوه دي انا شرحت عليكم كده، لكن الديفينيشن هو orientation of the heart in relation to the horizontal plane. Can you say that? Orientation of the heart in relation to the horizontal plane.
النورمال axis deviation بيكون من minus 30 degrees ل plus 60 degrees. ولو في
لا plus 90 or even up to 110.
If it's right axis deviation بيكون من plus 120 ل 180. If it was left axis deviation, it's from minus 30 ل minus 90. Or if it's facing the opposite direction, so like from minus 150 ل minus 90, it's extreme axis deviation.
Well then, from minus 90 to plus 180, the yellow area here. You have to go back in the lecture and keep repeating these things. I know it's tough, but ECG is very basic in medicine, regardless of what specialty you want to do. So you need to understand these things. So when do we use the ECG? I want contribution. What are the indications for ECG? Or what are the uses of ECG? كلكم شفتوا ECG صح؟
Yes.
طيب عايز تعرف الهارت ريت beats per minute. Number 1. عايز تعرف الهارت rhythm, is it normal sinus rhythm or abnormal rhythm? What do we call the abnormal rhythms?
Arrhythmia.
Well done. عايز تعرف السايز، بتعرف السايز كيف؟ سايز يعني hypertrophy, left LVH or RVH, right ventricular hypertrophy or left ventricular hypertrophy. How do you know the size of the heart from the ECG? By the axis. If the axis is normal, the size of the heart is normal. If you have left axis deviation, the left ventricle is hypertrophied or enlarged. If you have right axis deviation, the right ventricle is hypertrophied or enlarged. You also want to diagnose some heart diseases. Give me examples of the heart diseases you can diagnose using ECG.
Heart attack.
Heart attack, well done, but in medicine we don't call it heart attack. This is a layman term. It's called myocardial infarction, MI. Myocardial infarction. Myocardial is the heart muscle. The heart muscle is called myocardium, and infarction means death. So death of the heart muscle is called MI or myocardial infarction. And then some electrolyte disturbances. Give me examples of the electrolyte disturbances you can diagnose using ECG.
Hypocalcemia.
Hypo and hypercalcemia and hypo and hyperkalemia. Hyponatremia can also be diagnosed or has got some ECG signs. Now we move to what we call waves and intervals. Waves and intervals. Do you have any idea about the waves of the ECG in front of you here? They are named P, Q, R, S, T. And there is U wave, which you don't see on a normal ECG. So what are the waves? P, Q, R, S, and T. U wave you don't see on a normal ECG. The Q, R, S are related to each other. They are caused by the same reason. Therefore, instead of calling it Q, R, and S waves, we call it the QRS complex. The P wave is due to atrial depolarization on the action potential. The atrial depolarization doesn't show on the ECG because it is overlapped by the huge QRS complex, and the QRS complex is because of ventricular depolarization. T wave is due to ventricular repolarization, and U wave is due to papillary muscle repolarization. The U wave was on the quiz. You don't see it normally, but the cause of the U wave is papillary muscle repolarization. The papillary muscle is part of the left ventricle. So I want somebody to tell me what are the ECG waves and what are the reasons for this, or what are they due to. A volunteer. What are the waves in the ECG and what are they caused of?
The waves are broken into P wave, Q wave, and R, and S, and T. And QRS are called QRS complex. And the P is due to the atrial depolarization, and QRS is because of the ventricular depolarization. Meanwhile, the the T wave is because of the ventricular repolarization.
Well done. Now we move to the next slide. So we said P wave, QRS complex, T wave, U wave. These are atrial depolarization and ventricular depolarization and repolarization. Atrial repolarization you can't see it because it's covered by the QRS complex, and the U wave you can't see it also in normal ECG, but it is due to papillary muscle repolarization. So the intervals, there is PR interval, QRS interval or duration, QT and ST. PR, QRS, QT and ST. From the start of the B wave up to the middle of the R wave here, up to the start of the R wave, this is called PR interval. So from the start of the B wave, can you see my cursor?
Yes.
Can you see the cursor?
Yes, we can see it.
So from here, start of B wave up to the start of R wave, this is called PR interval. From the start of the Q wave up to the end of the T wave here, this is called the QT interval. From the start of the Q wave to the end of the S wave, this is called the QRS complex duration. From the end of the P wave to the start of the R wave, this is called the PR segment. From the end of S wave to the start of the T wave, this is called the ST segment. So we have three intervals, and there are 5 intervals. 2 of them are called segments. So PR interval, QRS interval, QT interval, PR segment, and ST segment. I want to volunteer very quickly. I would rather you understand than we have to finish the lecture very quickly. So we might have to split this lecture in 2, but it's very essential for you to understand what we are talking about here. So what are the intervals, the 5 intervals of ECG? And how do you define them? They are in front of you. PR interval, QRS duration, QT interval, 2 segment, PR segment and ST segment. Can anybody tell me where they start and end? PR interval from the start of B to the start of R, QRS from the start of Q to the end of S, QT from the start of Q to the end of T. PR segment from the end of B to the start of R, ST segment from the end of S to the start of T. Is that clear?
Yes.
Yeah, clear.
So you all understand the ECG waves and intervals?
All clear.
So the PR interval is normally 0.12 to 0.2 seconds. This number is important because if it's more than 0.2 seconds, this is called heart block. The QRS duration is less than 0.1 second. This is important because if the QRS complex is more than 0.1, this is called wide QRS, and it's a sign of ventricular tachycardia or prolonged. They call it broad complex QRS. The QT interval is very important for many medicines and for the function of the ventricles, and it is up to 0.4. These numbers are all important and you have to remember them. Prolonged QT interval predisposes to ventricular arrhythmias. Many medicines cause prolonged, and diseases cause prolonged QT interval. ST segment is very important for myocardial ischemia and myocardial infarction when you have ST segment elevation or ST segment depression. So the ST segment, you don't need to know how how long it is. You need to know whether it's in the isoelectric line or going up or down. So when it's going up, it's called ST segment elevation, and when it is going down, it's called ST segment depression. So it's very important to know whether the ST segment is sitting on the isoelectric line or is it above or below the isoelectric line. We are going to explain that. I don't want you to worry about it. ST segment is prolonged in hypocalcemia and is short in hypercalcemia because calcium is important for the action potential in the myocardial muscle. As we said, calcium influx is the cause for the delay or the plateau phase in the action potential of the myocardial muscle last time. Do you remember that? Do you remember when we spoke about the difference in the action potential between the cardiac muscle and the skeletal and smooth muscle? The reason for the plateau phase in the action potential in the cardiac muscle was the calcium influx. That's why the calcium affects the ST segment length. So it's either prolonged or short. I will say that again one last time. There are waves and intervals in the normal ECG. There are 4 main waves: P, Q, R, S, and T. And U you don't see it because you don't see it in the normal ECG, and it's due to papillary muscle repolarization. There is no name for the wave of atrial repolarization because it doesn't show on the normal ECG, because after atrial depolarization, the ventricular depolarization masks the atrial repolarization wave. Therefore, there is no wave for atrial repolarization. However, there is a wave for ventricular repolarization, which is the T wave. So the P wave, atrial depolarization, QRS complex, ventricular depolarization, T wave, ventricular repolarization. Atrial repolarization is masked by the QRS complex, and the U wave, which is due to papillary muscle, it doesn't show normally on a normal ECG. If you see a U wave, it's a sign of hypokalemia, low potassium. These are the waves. The intervals are 5: PR interval, QRS interval, and QT interval. PR segment and ST segment. PR interval from the start of B to the start of R, QRS from the start of Q to the end of S, and QT interval is from the start of Q to the end of T. PR segment is from the end of B to the start of R, and ST segment from the end of S to the start of T. Duration of segments are very important in disease for ECG diagnosis. The PR interval is normally up to 0.2 seconds. Anything above 0.2 seconds is heart block. It can also be short in tachycardia. QRS is normally less than 0.1 seconds. If it's more than 0.1 seconds, this is called broad complex, and it's a sign of ventricular ischemia. QT interval is up to 0.43. If QT interval is more than 0.43, this can cause ventricular arrhythmias, and there are many drugs or diseases that can cause that. ST segment is very important for myocardial infarction, heart attack. You need to see the ST segment because the ST segment can go up or down, above or below the isoelectric line. ST segment can also be prolonged in hypocalcemia and short in hypercalcemia because calcium influx is very important for the action potential of myocardial muscle. In fact, it is a cause for the plateau phase in the action potential of the myocardial muscle. واضح؟ Now we start analyzing the ECG. Okay, we start by the heart rate. How do you calculate the heart rate in an ECG? So the heart rate, I know this lecture is difficult, but you will have it on the YouTube, so you don't have to understand now, but you will have to repeat this again. So the heart rate is measured in beats per minute. Beats per minute. When the ECG is measured, the speed of the machine is in millimeters per second. If you divide the speed of the machine by the duration of one cycle in the ECG, this will give you the beats per second, because the machine is millimeters in second. When you multiply it by 60, this will give you the beats per minute. This is the reason why we put 60 in the formula, to convert the millimeters per second to millimeters per minute, because we want the heartbeat per minute. Any normal ECG machine will go at a speed of 25 millimeters per second. So when the ECG is measuring, it prints 25 millimeters of the ECG paper per second. Rarely, for units who do a lot of ECGs, sometimes they make it go faster to 50. So if the machine is measuring at 50 millimeters per second, instead of 25 here, you need to put 50 here. But most of the machines measure at 25 millimeters per second. The duration of one ECG cycle is the cardiac cycle. One cardiac cycle, one beat, one cardiac cycle. So the one cardiac cycle is in ECG, the most important landmark in ECG is the R wave. The R wave, because it is the longest, wave. So when we start from one R wave to the second R wave, this is one cycle. They call it RR. So if you divide the speed, which is 25, by the distance between the RR in millimeters, you get the heart rate in beats per second. To change it into heartbeats per minute, you multiply by 60. So to make your life easy, you don't have to understand this. It's better to understand it. But the formula for calculating the heart rate from ECG is 25 times 60 divided by RR. Is that clear? (25 times 60 divided by RR in millimeters. To make your life easy, this is one in ECG. In any ECG paper, there are large boxes and small boxes. Every large box has got 25 small boxes, which are 5 by 5. The horizontal plane on the ECG is the measurement of the distance. So every small box x-axis, the horizontal plane is 1 millimeter. 1 millimeter, 1 millimeter, 1 millimeter, 1 millimeter. There are 5 millimeters in every big box in the horizontal x-axis. So this is the speed. This is the distance in millimeters. So every small box is 1 millimeter. Every large box is 5 millimeters. Now, when the trace go up or down, this is electricity. So it's measured in millimeters, in millivolts. So every small box y-axis is 1 millivolt. When it goes above the isoelectric line, it's a positive millivolt. When it goes below the isoelectric line, it's a negative millivolt. So the big box has got 5 millivolts and 5 millimeters. Therefore, when I measure the RR interval, the distance between R and R in millimeters, I'm measuring the number of small boxes between the R's, because every small box is a millimeter. Is that clear? Let me give you an ECG. Any ECG, 1 second. So this is R and this is R. The distance between the two R's is called the R interval. If you count the number of small boxes between these two R's, it will give you that distance in millimeters. Is that clear? So in this ECG, Tara, in this ECG, what is the RR interval? Is Tara there? Jinwan, Shahad, Muhammad Al-Hadi, Tijani, anybody?
أيوة دكتور.
What is the RR interval in this ECG? عندنا 1 2 3 4 5 6 big boxes. أي واحد فيهم فيه 5 small boxes، يعني فيه 5 millimeters. يبقى what is the distance in millimeters in this RR interval? في 6 large وكل واحد فيه 5 30 millimeters. Do you all know how to measure the RR interval?
Yes, Dr. Ammar.
You measure it by the big boxes. So in this one, for example, 5 5 plus 5 plus 5 plus 5 20 plus 2 here. It's not right in the middle. There are 2 here. So this is 22. This one you have 1 2.5. So this is 10 12.5 millimeters. This one 1 2 3 4 5 6. These are 30 plus 2 32. واضح؟ Can you all measure the RR interval?
Yes. Doctor, بس معلش, how do you measure the boxes again?
A big box is 5 millimeters. So if you have from the line of big box to the line of big box here, actually this is not quite in the line, maybe 1 here. This 1 2 3 4 5 6 معناها this is 30 millimeters. 30 millimeters. Each large box is 5 millimeters. Each large box is 5 small boxes, and each small box is 1 millimeter. يبقى large box is 5 millimeters. يبقى you measure the number of large boxes and you multiply it by 5 between the two R waves. طيب in practice نحن ما بنعمل كده. In practice instead of using millimeters, instead of using small boxes, we just use the large boxes. So instead of using this in millimeters, we use this in 5 millimeters. ليه بنستعمل 5 millimeters؟ عشان to make a number ده، عشان to make the calculation easy, instead of calculating the small boxes, we calculate the large box. يعني نقول في 2 large boxes، ولا في 2.5 large boxes، ولا في 3 large boxes. يبقى لما ناخد هنا 5 ناس الرياضيات ممكن نشيل من ال 25 دي 5 صح؟ يعني ال RR interval بدل we measure it in millimeters, when we measure it in 5 millimeters يعني we measure it in big boxes، معناها instead of 25 here we can put 5 صح؟ we divide 25 by 5. يبقى if we say 5 times 60 يبقى ال RR interval here is measured in 5 millimeters. 5 times 60 is 300. يبقى out of all what I'm saying, if you want to measure the heart rate from any ECG, divide 300 by the RR interval in big squares. يعني إذا عندك 3 big squares 300 على 3 الهارت ريت is 100. إذا عندك 4 big squares 300 على 4 the heart rate is 75. If you have 5 big squares the heart rate is 300 divided by 5, 60. If you have 6 big squares the heart rate is 50. Out of this slide, I was just trying to explain to you how we calculate this formula. This formula you will not find it in the book, but you will find this one. But in practice, to make life easy, instead of small boxes, we use big boxes here. Therefore, we have to divide this by 5. لأنه هنا we will multiply by 5 here. If you multiply by 5 here, you have to divide 25 by 5. If the 5 times 60 is 300. All what I want you to do is calculate the big boxes between 2 R's and divide that number, divide 300 by that number, that will give you the heart rate. Let us go back to those ECGs. I don't know which slide, let me just find that slide. Again, this is slide, okay. Heart rate in this ECG equals 300 divided by the number of big boxes. 1, 2, 3, 4, 5, 6 big boxes. لأنه it's starting just before here and it's starting just before here. 1, 2, 3, 4, 5, 6. يبقى الهارت ريت هنا كم؟ لازم تحفظوا 300 على 3 100. يبقى 3 if there are 3 large boxes the heart rate is 100. If there are 4 large boxes the heart rate is 75. If there are 5 the heart rate is 60. If there are 6 the heart rate is 50. هنا في 6 معناه الهارت ريت كم؟ 300 by 6 50. هنا في 4 يبقى the heart rate is 75. The heart rate equals 300 divided by the number of large squares between the R waves. And to make your life easy, الcommon numbers for the heart rate هي لما يكون عندك 3 boxes the heart rate is 100. لما يكون عندك 4 boxes the heart rate is 75. لما يكون عندك 5 boxes the heart rate is 60. لما يكون عندك 6 boxes the heart rate is 50. واضح ولا عيد تاني؟ يبقى out of this slide all what I want you to do is to calculate the heart rate. You divide 300 by the number of big squares between each two R waves. To make your life even more easy مدينك النمبرز الكبيرة هنا اللي هي 3 4 لو عندك 3 boxes لو عندك 4 boxes لو عندك 5 boxes لو عندك 6 boxes. لو عندك 3 boxes معناها الهارت ريت is 100. لو عندك 4 boxes معناها الهارت ريت is 75. لو عندك 5 boxes معناها الهارت ريت is 60. لو عندك 6 boxes معناها الهارت ريت is 50. Okay? Normal sinus rhythm. What is normal sinus rhythm? Now we understood the principles of ECG, how to measure it, what are the electrodes, what are the leads, what is axis deviation, how do you calculate the heart rate, Eindhoven triangle. Now we want to start analyzing the ECG. What is the normal sinus rhythm? The normal rhythm is called NSR, normal sinus rhythm. What is the definition of the normal sinus rhythm? Back to anatomy, conductive system of the heart, pacemaker of the heart, sinoatrial node. When the heart rhythm starts from the normal native sinoatrial node, which is the normal pacemaker of the heart, this is called normal sinus rhythm. In ECG, this is reflected by the P wave. So if you have P waves in the ECG, this is normal sinus rhythm. P wave in the ECG means the rhythm starts at the pacemaker of the heart, which is the SA node. Is that clear? If the rhythm doesn't start in the SA node, there will be no P waves in the ECG, and this is called abnormal rhythm. If the normal rhythm is normal sinus rhythm, or normal sinus rhythm is when you see P waves on the ECG. If there is no P wave in the ECG, this is not normal sinus rhythm, because the electric activity does not start at the native sinoatrial node, which is the pacemaker of the heart. Clear?
That's clear.
Yes.
The normal sinus rhythm is when you see the P wave, while the normal rate is 60 to 100. There is difference between rate and rhythm. Rhythm is how it looks, and the rate is what we were calculating just a minute ago. So the normal heart rate is 60 to 100. Anything above 100 or below 60 is abnormal. So above 100 we call it tachycardia, fast heart rate. Below 60 we call it bradycardia, slow heart rate. If the heart rate is more than 100 but there are P waves, this is called sinus tachycardia. So the heart is fast, but the rhythm is starting from the sinoatrial node. If the heart rate is below 60, this is bradycardia, but there are P waves. The heart is slow, but it is still starting from the normal pacemaker of the heart. This is called sinus bradycardia. I want somebody to define sinus tachycardia and sinus bradycardia to me. What is the normal heart rate and what is tachycardia, and what is bradycardia, and what is sinus tachycardia, and what is sinus bradycardia? Quickly. Any volunteer quickly? I'll say it again. Normal heart rate is 60 to 100. Anything above 100 is tachycardia. Anything below 60 is bradycardia. When we have tachycardia, which means heart rate above 100, in the presence of B waves, this means sinus tachycardia. That means the heart rate is fast, but the rhythm is still starting from the normal pacemaker of the heart, which is the SA node. When the heart rate is below 60, this is bradycardia, but there are still B waves. This is called sinus bradycardia, which means the heart is slow, but the rhythm is starting from the normal pacemaker of the heart. Does that make sense? Can anybody say that? What's the normal heart rate? What's the abnormal heart rate? What's tachycardia? What's bradycardia? What's sinus tachycardia? What is sinus bradycardia? Tijani.
Normal heart rate is 60 to 100. Anything over 100 is abnormal and it's tachycardia, so it's higher heart rate. And then anything below 60 is bradycardia, so below 60.
Brady, Brady. Yes.
Yeah.
Good. So what's sinus tachycardia and sinus bradycardia? Ala, what is sinus tachycardia and what's sinus bradycardia? When the heart rate is above 100, but there are P waves, this is sinus tachycardia. When the heart rate is below 60, but there are P waves, this is sinus bradycardia. Okay? So sinus tachycardia and sinus bradycardia both can be physiological or pathological. So when you are excited or you have pain or you have hypoglycemia or during exercise, your heart rate will go more than 100, but with B waves, you are still producing the rhythm from the SA node. This is physiological sinus tachycardia. If you have hyperthyroidism or some drugs like beta-adrenergic agonists, this will cause sinus tachycardia pathological. If you are sleeping, your heart rate might go below 60, but with still B waves. This is called physiological sinus bradycardia. Athletes, people who do a lot of exercise, they are always having normal heart rate below 60, and this is called physiological sinus brady. People with hypothyroidism can have pathological sinus bradycardia. Now we go in practice. In this ECG, this is not a 12-lead ECG. We're just taking one lead out of the 12 lead. There is P wave, QRS complex, and T wave. B wave, QRS complex, and T wave. P wave, QRS complex, and T wave. So this is normal sinus rhythm. The distance between every R and R is equal, so it's regular. So this is normal sinus rhythm. This ECG is regular. It has got QRS and T in every complex, but there is no B wave. there is no P wave, there is no P wave, there is no P wave, there is no P wave. So this is called junctional or nodal rhythm. And when we say nodal rhythm, we don't mean the sinoatrial node, because there is no P wave. The rhythm here starts from the AB node, not from the SA node. So when there is a problem with the SA node, the rhythm starts from the AB node, and in that case we call it nodal or junctional, because the AB node is in the junction. It's responsible for conduction. We call it nodal rhythm. So when you have an ECG with a regular rate and QRS and T waves but no P waves, this is called nodal or junctional rhythm, and by nodal we mean AB node. So the rhythm, instead of starting in the SA node, it is starting in the AB node, because the AB node is responsible for ventricular depolarization, and the ventricular depolarization is represented in the ECG by the QRS complex. So the QRS complex is starting the rhythm, and the QRS complex represents the AB node. So when there is no P wave but QRS complex, this is called nodal or junctional rhythm. Sinus arrhythmias, sinus bradycardia. If we calculate 1, 2, 3, 4, 5, 6, more than 6, so the heart rate here is less than 50. But there are P waves, there are QRS complexes, there are T waves. P, QRS, T. P, QRS, T. But the heart rate is below 50. So anything below 60 with P waves is sinus bradycardia. P wave, QRS, T, P wave, QRS, T, P wave, QRS, T, that's normal, but the heart rate is 1, 2.5. So the heart rate is more than 100, because if you have 3 boxes, the heart rate will be 100. You have less than 3 boxes, so the heart rate is more than 100. So if the heart rate is more than 100 and there are P waves, this is called sinus tachycardia. Clear? Shall I repeat that, or is this slide clear?
معلش دكتور بس ممكن تعيد sinus bradycardia.
Okay. If you have 1, 2, 3, 4, 5, 6. If you have 5 boxes in any ECG between R and R, that means the heart rate is 60. Okay? Anything more than 5, that means the heart rate is below 60. Because the way we calculate the heart rate is we divide 300 by the number of boxes. So any number more than 5 boxes, 1, 2, 3, 4, 5. Anything more than 5 boxes, that means the heart rate is below 60. In this patient, we have 6 boxes. That means the heart, more than 6 boxes. That means the heart rate is below 50. So this is slow. This is less than normal. However, there are B waves. The presence of B waves makes it sinus. And the fact that it's less than 50 makes it bradycardia. So this is sinus bradycardia. Here is the reverse. There are P waves, but the heart rate is less than 100. Sorry, is more than 100. Anything less than 3 boxes. Look at this here. The box starts from here, and this box starts from here. So the R, both R's are inside the 3 boxes. That means you have something like 2.5 boxes here. So anything less than 3 boxes means the heart rate is more than 100. لأنه لما يكون عندك 3 boxes the heart rate بيكون 100. أقل من 3 boxes معناها complexes are closer to each other. closer to each other معناه النمبر يعني imagine كان عندك only 2 boxes. Who was asking the question?
I was asking the question.
Yeah, if you have only 2 boxes between R and R, the heart rate will be how much? Anybody? If you have only 2 boxes,
150.
150. إقبل لما يكون عندك less than 3 boxes, the heart rate is more than 100. More than 100 means it's tachycardia. صح ولا ما صح؟
Yes.
But there are B waves. What does that mean? Sinus tachycardia. This is sinus because there are B waves, and it's tachycardia because the heart rate is more than 100. The heart rate is more than 100 because there are less than 3 boxes. Anything less than 3 boxes means 100. Anything less than 3 boxes means more than 100. For example, 2 boxes means 150. I think this is too much. Do you want to continue, or shall we split this lecture into 2 parts? We can revise and then we have a second lecture. Or do you want to continue? Let us finish the atrial arrhythmias, and then we will revise and then continue. Sometimes you have, we said, if you have P waves, this is sinus rhythm. If you don't have P waves, this is not sinus rhythm. Sometimes you do have P waves, but their shape is not normal, like this. They are deformed P waves. This is still sinus rhythm, but it's called extrasystole. So you have premature discharge. You have an atrial focus in the sinoatrial node, but it is producing excessive discharge. This is called extrasystole because the B wave, this was one of the questions, the B wave is deformed, the B wave is abnormal. So when you find an abnormal B wave, this is called atrial extrasystole. It's a type of atrial arrhythmia. Sometimes you have so many B waves, so many B waves, so many B waves. If you have so many B waves, this is called atrial tachycardia. And atrial tachycardia is normally around 200 beats. 200. So if you see, if the distance between 2 B waves is 1 box, that means 300. So you have a lot of B waves here, a lot of B waves. Not all of them have got QRS complex. This is called atrial tachycardia. If the B waves are just ongoing, like a sawtooth, this is called atrial flutter. So atrial flutter means instead of having a flat isoelectric line, you have an up and down isoelectric line like the sawtooth. This is called atrial flutter. And the atrial flutter is normally, the P waves are normally between the atrial rate. When we talk about the P waves, we talk about the atrial heart rate. The QRS, the ventricular heart rate. So when the atrial heart rate is up to 200, this is called atrial tachycardia. If it is more than 200, this is called atrial flutter. And the atrial flutter is called, the appearance of the ECG in atrial flutter is called sawtooth. So it's like, it's all B waves, all B waves. So the atrium is contracting continuously. This is called atrial flutter. When in atrial flutter, the ventricle is not responding to all the B waves, is responding to some B waves, but not all the B waves. Therefore, the ventricular rate is far less than the atrial rate. So the atrial rate here is between 200 and 300, but the ventricular rate 1, 2, 3, 4. So the ventricular rate is about 75 here, but the atrial rate is more than 200. When it goes above 300, the atrial rate, but it's not seesaw, this is called atrial fibrillation. And in atrial fibrillation, or AF, this is very important, AF, 1% of people have AF. In AF, the ventricular, the atrial rate is very high, but more importantly, the ventricular rate is also fast and irregular. If you see the distance between R and R here, they are not equal. The distance between R and R normally are equal. So the distance between R and R, look at this here, and look at this here, look at this here. So this is called irregular. So in atrial fibrillation, number one, no B waves. Number two, the distance between R waves is not equal. So it is irregular. So you can't calculate the heart rate here because the distance between each R and R is not equal. This is called atrial fibrillation. So atrial arrhythmias, it can be abnormal B wave. This is called atrial extrasystolis, or rapid B waves more than 200. This is called atrial tachycardia. When it is very rapid, ongoing continuously, more than 300, more than 200, this is called seesaw isoelectric line or atrial flutter. When you have irregular heartbeat, that means the distance between R and R is not equal, with no P waves, this is called atrial fibrillation. So atrial fibrillation, no P waves, and the distance between R and R is not equal. Atrial flutter, continuous P waves. The difference is here there is no P wave in atrial fibrillation. Here there is rapid discharge, so many P waves, all P waves. This is called, the isoelectric line in a normal ECG is flat. When it is like zigzag or sawtoothed isoelectric line, this is called atrial flutter. And when the P wave is there but it's abnormal, this is called extrasystoly. So what's the difference between extrasystoly, atrial flutter, and atrial fibrillation? We'll finish with this slide because this is too much for you now. I just want somebody to tell me. So extrasystolis, the B wave, the shape of the B wave will be abnormal, like this. This is a normal B wave, this is a normal B wave, this is an abnormal B wave. The atrial flutter, the isoelectric line is not straight line, is like zigzag or sawtoothed isoelectric line. Atrial fibrillation, no B waves. And if there are no B waves but the ECG is regular, this is called nodal rhythm. But if there are no B waves but the ECG is irregular, this is called atrial fibrillation. I want somebody to repeat that. extrasystole, atrial flutter, and atrial fibrillation. And then we will just recap and we will split the lecture. What's extrasystole? What's atrial flutter? What's atrial fibrillation?
In atrial extrasystole, the P wave is shape is abnormal, and it's not all on a horizontal thing. But in atrial flutter, the P waves are many and they're all wavy, with the QRS being diminished. In atrial fibrillation, there is no P wave, and the R to R intervals are uneven.
Excellent, excellent. This is an exemplary answer. So because it's too much, I realized we just go back to recap what we have discussed so far. So first of all, we said ECG is very important, widely used, not costly, no side effects, test of electrical activity of the heart. It takes only 5 minutes or less to do, and it gives you a lot of information. In order to do an ECG, you need to put on the patient stickers. These stickers, I'm not going to go through the conductive system. Do you want me to go through the conductive system? SA node, interatrial pathways. The other name for the interatrial pathways is Bachmann's bundle. AV node, AV bundle. The other name for AV bundle is bundle of His. The AV bundle divides into right bundle branch and left bundle branch. The left bundle branch divides into anterior fascicle and posterior fascicle. The small branches of the bundle branches are called Purkinje fibers. This is the conductive system of the heart. In order to do an ECG, the ECG technician will put stickers on the patient. These stickers are connected to electrodes. So these are the electrodes. The electrodes are connected to the patient using stickers. There are 10 stickers, 4 limb electrodes and 6 chest electrodes. The 4 limb electrodes are named after the limbs: right arm, left leg, right leg. The 6 chest electrodes are named V1 to V6. V1 is put in the second intercostal space, just right to the sternum. The second intercostal space is known by the angle of Louis, or sternal angle. V2 is put at the same side, second intercostal space, but at the left side of the sternum. V4 is put corresponding to the apex of the heart, which is the 5th intercostal space, mid-clavicular line, and V3 is put between V2 and V4. V4 and 5 and 6, they are all in the 5th intercostal space. Normally in men, the space below the nipple is the 4th, so the space after that is the 5th. So V4, V5, V6 are all in the 5th intercostal space, but at different levels. V4 is at the mid clavicular line, V5 at the anterior axillary line, and V6 is at the middle axillary line. These are the electrodes. So for the electrodes, One second, let me just get this phone call. So these are the electrodes. Now there is a difference between the electrodes and leads. Electrodes are the stickers and the cables connected to the ECG machine. The leads is what you actually see in the ECG. So you see 12 leads on the ECG. The 12 leads are divided into unipolar and bipolar. There are 9 unipolar and 3 bipolar. The 9 unipolar are divided into limb leads and chest leads. Each lead is between an active electrode and an inactive electrode. The inactive electrode or the reference electrode is the one which is farthest from the heart, which is the right leg electrode. So the right leg with any one of the other electrodes will form a lead. This is for unipolar. For bipolar, you will have 2 active leads with the inactive. We start with unipolar. In unipolar, you have 3 limb leads between the right and the inactive, the left arm, and the inactive, the left leg, and the inactive. They are called VR, V for the right arm, VL for the left arm, and BF for the foot. The chest leads are named the same as the electrodes. So when we say lead V1, that means the lead between electrode V1 and RL. Lead V6, the lead between electrode V6 and RL. The unipolar, the bipolar names are easy, 1 to 3. So between the 2 arms and the inactive is 1, between the right arm and the left leg and the inactive is bipolar 2, between the left arm and the left leg and the inactive is bipolar 3. In the middle of the 3 bipolar leads, in the center there is a heart. So this is lead 1 bipolar, this is lead 2 bipolar, this is lead 3 bipolar. If we create a triangle, that's called Einthoven triangle, and this triangle is important because it helps us deciding the axis of the heart. Because the heart apex is facing inferiorly and to the left, the normal axis is between -30. We are referring to the horizontal 0 plane, -30 to +90. This is the normal heart. It can go up to +110. Anything below -30 down to -90 is called left axis deviation, and from 110 up to 180 positive is called right axis deviation. Between 180 and -90, the yellow area here is called extreme axis deviation. Then we said ECG is used to calculate the heart rate, and we know how to calculate the heart rate. You count the number of large boxes between the any 2 R's in regular ECGs, and divide 300 by that number. So if there are only 2 large boxes, the heart rate is 150. If there are 3 large boxes, the heart rate is 100. If there are 4 large boxes, the heart rate is 75. If there are 5 large boxes, the heart rate is 60. If there are 6 large boxes, the heart rate is 50. Rhythm, we said normal sinus rhythm when there is P wave, because the P wave is a sign of conduction starting at the sinoatrial node. Abnormal electric conduction when there is no P wave, and that can be nodal from the AV node or from the ventricle. Myocardial infarction, coronary artery disease, or electrolyte disturbances. Then we spoke about the waves and intervals of ECG. We said there are 4 waves, P wave, QRS complex, T wave, and U wave. P wave is atrial depolarization, QRS is ventricular depolarization, T wave is ventricular repolarization, U wave, which doesn't show on the normal ECG, is papillary muscle repolarization. There is no wave for atrial repolarization because it's masked by the QRX complex of ventricular depolarization. So we have atrial depolarization and ventricular depolarization and repolarization, but there is no atrial repolarization. However, there is a U wave, which is repolarization of the papillary muscles. So ventricular repolarization in general is T wave, but when the papillary muscles inside the ventricle get repolarized, they produce another wave, which is called U wave after the P wave here. But the U wave, you can't see it on the normal ECG. Intervals, we said there are 5 intervals: PR interval, QRS interval or duration, QT interval, PR segment, and ST segment. PR interval should be less than 0.2, QRS should be less than 0.1, QT should be less than 4.3. ST segment is very important in myocardial infarction. We would like to make sure the ST segment remains at the same level as the isoelectric line, because if the ST segment goes up or down, this is a serious sign, which means myocardial ischemia or myocardial infarction. We will come to that. Calculation of the heart rate, we said we need to calculate the number of R waves, like in this ECG. Sorry, this is a moving ECG. Let me get another ECG. Heart rate calculation is very simple. All what you need to do is check how many number of big boxes you have between every. First of all, check that, make sure the ECG is regular. Regular, that means the distance between all the R's are equal. So this is regular ECG. ECG is regular, calculate the number of large boxes. Then divide 300 by that number. So 1, 2, 3, 4. 100 by 4, the heart rate here is 75. 1, 2, 3, 4, 5, 6. 300 by 6, the heart rate is 50 here. 1, 2, 3. 300 by 3, the heart rate is 100 here. واضح so far? Then we said normal sinus rhythm when there is a P wave, abnormal sinus rhythm when there is no P wave. And we said this is normal sinus rhythm because there are P waves with every QRS complex, BQRS, T. This is regular, the distance between R and R is equal, but there are no P waves, so we call this nodal or junctional rhythm. This is regular, there is P wave, QRS and T, but the heart rate is below 60, so it's called sinus brady. This is regular with P waves, but the heart rate is more than 100, so this is sinus tachycardia. Then we said atrial arrhythmias, extrasystolis, when the P wave is abnormal. This is normal P wave, but this is an extrasystole. So this is normal, this is the top of the normal. So you would expect that this distance, you would expect to wait for equal distance, but something happened before then. This is extrasystole. The isoelectric line is normally straight. When it is tooth-shaped like this, that means there are many P waves. When it's wavy, zigzag, this is called atrial flutter. When the heart rate is irregular, that means the distance between R is not equal and there is no P waves, this is called atrial fibrillation. And by this we conclude the first part of the lecture. Because it's a difficult lecture, I insisted on you to study before we started. So before we complete this lecture, next time, make sure you go back and read. You don't have to read that book I gave to you. Just if you at least read from core, you will make explanation easier, and you'll make an understanding of ECG. A lot of doctors, senior doctors, find understanding of ECG difficult. It's not only you. Even when we become consultants, not all people, they always give it to the cardiologist or cardiac surgeons to read, but at least for your undergraduate, for your exams, you need to understand the principles of ECG. Any question or comments? Okay, if there are no comments, we are going to conclude this lecture, and inshallah we will continue next time with the second part of the ECG and echocardiogram. Thank you very much for attending, and I hope it was useful.